One of the greatest obstacles to crafting health and wellness is identifying and controlling inflammation. It's at the core of all complex and chronic diseases, and it's the driving mechanism that underlies the most common symptoms that people like you struggle to overcome. Join us as we explore cutting-edge science and research to give you the information and tools you need to create the quality of life you want and deserve. And now, here is the host of Inflammation Nation, Dr. Stephen Noseworthy.
Hey guys, welcome back to the Inflammation Nation podcast. Episode 92 today, we're talking about food sensitivities, and we're still in this series of looking at lab tests that I would spend my own money on. And what I'm trying to do is help you guys understand what's available to you out there and some of the pitfalls where you might want to not invest money in tests that aren't going to really help you. And so we're talking about tier 2 testing, which is the set of tests that I don't do on everybody, but I commonly do. And it's all context specific. So we're talking about food sensitivities today, and it might take me a couple of episodes to get through everything that I want to share on this. I'll see if I can get it done in one 20 to 25 minute episode. We'll see how that goes. And the first thing to know about testing for food sensitivities is that there is no perfect test out there. The immune system is too complex, and there are too many different ways for your immune system to respond to food that there's not a single test or technology that's going to check for everything. And so labs are challenged with picking a testing model that basically gives what they believe to be the best combination of things to give you the clearest yet still incomplete picture of food reactivity. Here's an example. If you go to see a medical immunologist, like a medical allergist, for example, who is going to test you for food allergies, he or she is going to test for specific antibodies or an antibody response called IgE. And they can do that with a blood test. They can do that with skin prick testing. Sometimes they'll use like a patch that they'll stick on your arm for a while, and then they peel it off to see if you've got some kind of a skin reaction. And so IgE is an antibody that's made by a specific part of your immune system that creates what are called immediate onset responses. They're also called type 1 hypersensitivities, and these are the ones that we associate with things like peanuts and shellfish, where someone gets a rash, they get hives, or their lips swell up, and maybe they have to take some kind of an EpiPen injection or go to the hospital. And these are true allergies that have the potential to be lethal from anaphylactic shock. But if your immune reaction to any food of concern is through a different branch of the immune system, for example, an IgG response as opposed to an IgE response, then you go see the conventional doc, and they do testing, and you end up walking away thinking you're not reactive to foods when in fact you are. Your doctor just looked in the wrong place. So to understand this, let's better clarify some terminology. And I'm going to distinguish between allergy, sensitivity, and intolerance. And unfortunately, these words, including myself, they're somewhat used interchangeably. And so depending on what you're listening to or what you're reading, there may be some confusion. So let's go with kind of strict definitions, and that will allow for people to use terms somewhat incorrectly. It is what it is. So allergy, so to understand the difference between allergy and sensitivity, as intolerance is off to the side. In fact, let me start with intolerance. Intolerances are related to non-immune mediated responses. For example, lactose intolerance is not a food sensitivity. It's not an allergy. It's a lack of an enzyme where someone can't break down a sugar called lactase or lactose because they lack the enzyme lactase, and that can cause typically GI cramping, sometimes diarrhea. So lactose intolerance is an enzyme deficiency, and that's got nothing to do with the immune system. It's not an allergy, and it's not a sensitivity. So intolerance, again, is kind of off to its side. But let's distinguish between allergy and sensitivity, because those are the things that are commonly used interchangeably, but technically they are different. And this is where sometimes we get into semantic arguments with our conventionally trained counterparts, because I might use the word food allergy a little bit loosely, and they're using it very, very strictly. So what is the difference? Well, first of all, understand that there are four major antibody systems that can create reactions, whether it's to food or other things. And these antibodies are IgG, and Ig stands for immunoglobulin. So IgG is a G-type subclass of immunoglobulins. There's IgG, IgA, IgM, and IgE. And you can remember that with the word GAME, G-A-M-E. And so IgE reactions, as I said a moment ago, give us these type 1 mediated immediate onset food sensitivities. And again, true allergy, typically you're going to see hives, itching, lips swell up, face swells up, airway closes down. Reactions are very quick, so usually within minutes. And again, someone eats a peanut, or it's the same thing with a bee sting, even though it's not food related, you get the idea. Someone gets like immediately a scratchy throat and hives. And these are typically the people who have these types of reactions, if they're known, carry an EpiPen. And again, these are the ones that can end up in anaphylactic shock. Now, IgG reactions are called delayed onset sensitivities. They're mediated through a different immunoglobulin pathway, a different part of the immune system involving a different antibody. And they come on after some kind of a lag time. So they don't come on as soon as you eat it or within minutes. That lag time can be as short as a few hours, or it can be as long as 3 days. And this is why sometimes food sensitivities are so difficult to pin down, because you might get, for example, a migraine headache as a result of eating food. And that's only one example of how foods can affect somebody. But let's say you get a migraine headache tonight. Maybe it's not what you had for dinner today. Maybe it's what you had for lunch 2 days ago, right? And that's the difficulty. And that's one of the major differences between true allergy and sensitivity, is not just the manifestation of the type of sensitivity, but it's the mechanism, the underlying mechanism, which involves a different chemical pathway or a different branch of the immune system. And typically IgG reactions don't create the same type of reaction as an IgE allergy response, because again, it's a different part of the immune system which behaves differently. IgG responses also don't show up in IgE testing, and I want you to remember that, because that's important. Something else that we might say about the difference between true allergy and true sensitivity, as it relates to the difference between IgE responses and IgG, is that if you have two people who both have true allergy, they're both exhibiting IgE-based responses to foods, they might react when they eat different foods. Like, for example, let's say I am IgE reactive to shellfish and you are IgE reactive to peanuts. Typically, the symptoms are the same, even though the food is different. Or maybe I have multiple IgE reactions, and it doesn't matter which of them I eat, I always get the same thing. My face swells up and my airway closes down. I get itching, I get hives, I get a rash, something in that area. But IgG sensitivities are different. Not only are they delayed responses, but they have more to do with the individual than it has to do with certain types of foods that are typically associated with IgE responses, or the classic IgE symptom response. Let me say it this way. IgE responses tend to create the same symptomatology from person to person to person, whereas IgG sensitivities tend to create different symptoms even to the same food using the same immune pathway that differs from person to person to person. Let's say you and I both have a sensitivity that's mediated through IgG as a delayed onset response, and let's say it's to dairy. And you eat dairy and you get sinus congestion and a cough and whatever, something in your head, and maybe I get joint pain and swelling. And so again, IgE responses create the same symptoms from person to person, whereas IgG response can create any symptom in any body, completely different. So that's IgE and IgG just in a quick nutshell. Obviously, there's more detail to that, but we're keeping things pretty high level. With the IgA system, IgA or A-type immunoglobulins, these are generally typically generated by the gut-based immune system, and they can be tested in saliva as well as serum, and it's possible to have an IgA response to a food and have neither an IgE or an IgG response. And again, if you go see a doctor that only tests for IgG and your reaction is IgE or IgA, then they're going to miss it and tell you, hey, you're not reactive to fill in the blank, whatever food or foods are being tested. And then there's the IgM response, which is not common since IgM antibodies are really only evident within the first 3 weeks of the very first exposure, and it doesn't apply to chronic reactivity. And so invariably, the people that we do food sensitivity testing for are in a chronic situation. They'd be reacting to foods for certainly longer than 3 weeks. It would be unusual to catch somebody within that mirror or that in that window of time. And so for the most part, when we're looking at which antibody system is involved, we're considering IgE as true allergy, or IgG and or IgA as the main ways that we can get these delayed onset sensitivity responses. Now, without getting into details, there's another part of the immune system that can be involved in this, and that's called the complement system, which in and of itself doesn't really do all that much. But when you have, for example, an IgG response to a food, and at the same time, you have a complement response, the complement will magnify the IgG response to a factor of at least 1,000-fold. Some estimates are 1,000 to 10,000 in terms of the increase in the sensitivity responses. And so complement can be involved. There's only a couple of labs that actually measure complement in the context of food sensitivities, but by themselves, they don't do much. They have to be linked with another type of response, classically the IgG response. But again, sometimes these details are nice to know. It doesn't really change all that much in the bigger picture. So as you can see, even with that brief and top-level description, your immune system has many different ways to create a reaction to foods. And as I said earlier, no single test will ever check for all possible reactions. And so we have to use clinical context to decide which type of testing is best suited to an individual circumstance. Again, for example, let's say if someone tells me that they have hives and itching and swelling and we think that food is the culprit, then we might go down the IgE classical allergy testing route. But if they don't have those IgE specific symptoms and their symptoms are vaguer or maybe more generalized, then we might go the IgG testing route, maybe IgA, maybe a combination of those. And, common in IgG reactivity are simply gut complaints, pain, fatigue, brain fog, headaches, joint swelling, mood changes, and so on. And so it's really important to remember that one of the big decisions is, do I go IgE or IgG or IgA, which is a little bit less common than IgG. And one of the tip-offs is, what's the classic symptom presentation? If someone says, I have a weird rash, I get itching, I have hives, or I eat something and my face swells up, then you're thinking true allergy. And if they don't have that, you're thinking sensitivity. And that by itself really dictates which diagnostic pathway you go down. So this, again, from this top-level perspective, just simply ask yourself, do I need IgE classical allergy testing, or is it better to go with IgG delayed onset testing and just simply start from there? Now, in my opinion, and I am speaking directly from my own experience, and some people might disagree with me, and that's okay. In my opinion, I observe that IgG reactions are more prevalent than IgE, or to say it another way, sensitivities are more prevalent than allergy. And that opinion, of course, might be colored by the type of people that I've worked with over the last 25 years or so. And I recognize that I only see what I see and other people see what they see, and we might be seeing different things. But for the sake of this conversation, let's just assume that most food-based reactions are of the IgG, sensitivity, or delayed onset type. Then the question is, well, what else do I need to know about food sensitivity testing? Well, we can boil it down to a couple of things, and I'm going to list them, and then we're going to talk about them. So the first thing, let me go through the list first. So three things specifically that you need to know about food sensitivity testing. Number one is you have to be eating the foods that you want to test to get reliable results, and I'll break that down here in a second. You also have to know that some things can cross-react with foods, and give false positives, even to foods that you've never eaten. And then finally, food reactivity can change based on whether or not food is cooked or food is raw, and how these things are tested for. So let me explain. The first item on this, and this is again like other things that I need to know about food sensitivity testing, other than the major classifications of IgE versus IgG, of allergy versus sensitivity. So the first thing is, and this is like a really important rule for doctors to understand. Number one is that you have to be eating the foods that you're testing for when you're looking for any of these immune-based responses, including the IgG delayed onset sensitivities. If you eliminate a food from your diet, say it's wheat or dairy, very common ones, and you've done that for more than a month or so, then more than likely, if you run a test, you're going to get a false negative. Why? Because when you get rid of any food that you are reacting to, whatever antibodies that you were making when you were eating that food, the ones that would signal a reaction and give us a positive test, are back to normal after 6 weeks. It takes about 6 weeks for antibody levels to go from an elevated state to a normal state so that we think something is negative. So the rule is you have to have eaten any given food in the last 3 to 4 weeks to even be able to measure a potential positive response. And that's why when I think IgG food sensitivity testing might be appropriate, the first thing we do is we look at the list of items on the test and we ask whether or not this person I'm talking to are currently eating enough of these foods to justify spending money on it. If somebody has limited their diet to down to just a handful of foods that they eat on a repeated basis, for whatever reason they might have done that, then spending money testing 180 different foods might be a gigantic waste of time and money because they're not eating the majority of things that you're testing for. And the most common time this becomes an issue is testing for example, gluten sensitivity. Now, I'm going to do a separate podcast on that specifically because it's so common and important. It needs its own episode. But suffice it to say for now that if you come to me and you've been gluten-free for more than a month, let's be more specific, say for more than 6 weeks, and you want to test to see if you're reacting to gluten, the test won't work. And it's not always wise to eat gluten just for the sake of the test, because someone will say, Doc, I want to know if I'm gluten sensitive. I've been gluten-free for 3 months or 6 months or a year. Well, when I explain to them that they have to eat gluten for the test to be reliable, they say, well, I should do that. And that just really depends on the person. It's not always wise to eat something that you might be reacting to just for the sake of the test. And it comes down to how sensitive and how, I'm going to use the word fragile, but I don't want to give the wrong impression. But you know how some people are very sensitive to things and they have a lot of different triggers for their flare-ups. And when they get flared up, things are really bad and they stay flared up for a very long period of time. That is not the person who should eat gluten just for the sake of a test. They just shouldn't do it because the risk of getting into a flare-up that might take weeks, if not months, to calm down, it's just not worth it. And so we have to deal with these on a case-by-case basis. We have general guidelines and we have rules that guide us in our understanding of what testing methodologies are available to us. And then we look at individual circumstances and say, which path do I want to go down and how do we understand the relationship between getting good results or getting bad results, and are we going to waste our money if we do that? So let me do this because there's still more for me to talk about with this particular topic. I'm going to stop it here. It's a little bit shy of where I typically go in terms of how long these episodes are, but I'm right at a breaking point here. We'll be back in the next episode and we'll finish off this discussion, and I might come back and reiterate a few of the high points of this particular episode just so that we repeat things that are really important. And, repetition obviously is part of the learning process. The more you hear something, the more it gets ingrained into your brain. All right, so hang tight. We'll be back in the next episode and we'll return to talking about food sensitivity testing.